Imagine for a moment a universal language for diseases and injuries. Picture a system so comprehensive and detailed that it allows doctors, nurses, researchers, and health officials from every corner of the globe to speak the same language when it comes to health. That's essentially what ICD-11 is, the International Classification of Diseases, 11th revision. Developed by the World Health Organization, it's the latest evolution of a system that's been guiding global health for decades. This system provides a detailed catalog of health conditions, each with its own unique code. These codes are used by healthcare professionals everywhere to record, report, and monitor diseases and injuries in a consistent way. From a common cold to, complex cancers, ICD-11 covers it all. It doesn't matter if the illness is rare or widespread, ICD-11 has a place for it, making sure nothing is left out. But why is this important? Well, without a shared system, it would be nearly impossible to compare health data between countries or even between hospitals. Accurate health data is crucial for everything from tracking disease trends to planning healthcare services. It helps governments and organizations respond quickly to outbreaks, allocate resources, and improve patient care. ICD-11 offers a standardized way to collect and analyze health information globally. This means that whether you're in Tokyo, New York, or Nairobi, the data you collect can be understood and used by others worldwide. This allows for better research, improved public health policies, and ultimately, better healthcare for everyone. It also helps scientists identify new health threats and track the effectiveness of treatments. Think of it like this. ICD-11 is the Rosetta Stone of medicine, allowing healthcare professionals around the world to communicate and share information seamlessly, no matter what language they speak. This shared language is essential for tackling global health challenges, advancing medical knowledge, and ensuring everyone has access to quality care, no matter where they live or what language they speak. The World Health Organization officially adopted ICD-11 in 2019, marking a significant milestone in global health data management. Since then, numerous countries have transitioned to this updated system, recognizing its potential to, honestly, revolutionize healthcare. While adoption is an ongoing process, many nations are already reaping the benefits of ICD-11. Countries like South Korea, Turkey, and the Netherlands are leading the way, demonstrating the feasibility and advantages of this new era in medical coding. The transition to ICD-11 is a testament to a global commitment to improving health information systems and advancing healthcare worldwide. ICD-11 utilizes an alphanumeric coding system, where each health condition is assigned a unique code. This code acts like a fingerprint, providing a specific identifier for each diagnosis. These codes aren't random. They're organized logically into categories and subcategories, creating a hierarchical structure. This makes it easy to navigate the system and, honestly, find the precise code for any given condition. Think of it like a library. Books are grouped by genre, then further divided by author and title. Similarly, ICD-11 organizes diseases by body system, then further categorizes them by specific characteristics. This logical structure ensures consistency, accuracy, and ease of use for healthcare professionals around the globe. ICD-11 is divided into 22 chapters, each focusing on a different aspect of health and disease. These chapters cover everything from infectious diseases to mental health disorders, injuries to genetic anomalies. For example, Chapter 2 focuses on infectious diseases, while Chapter 5 delves into mental, behavioral, and neurodevelopmental disorders. Each chapter is further divided into blocks, which contain specific categories and codes for individual conditions. This comprehensive framework ensures that every possible health scenario is accounted for, allowing for accurate coding and data collection. This detailed categorization enables healthcare professionals to, quickly and easily locate the appropriate codes for their patients' conditions. While ICD-10 served as the global standard for many years, ICD-11 represents a significant leap forward in medical coding. It incorporates advancements in medical knowledge, technology, and data analysis. One key difference is, honestly, the level of detail. ICD-11 provides more granular codes, allowing for greater precision in diagnoses. This is particularly important for complex conditions with multiple factors. Furthermore, ICD-11 is fully electronic, making it easier to integrate with electronic health records and other digital systems. This really streamlines data collection, analysis, and sharing. The transition to ICD-11 marks a new era of accuracy, efficiency, and interoperability in global health data. SNOMED CT, or Systematized Nomenclature of Medicine, clinical terms, is another important player in the world of medical coding. It's a comprehensive clinical terminology system that provides detailed descriptions of medical concepts. While ICD-11 focuses on classifying diseases and health conditions, SNOMED CT provides a richer, more nuanced vocabulary for describing those conditions. For example, SNOMED CT can describe specific symptoms, findings, and procedures in greater detail. The good news is that ICD-11 and SNOMED CT are designed to work together seamlessly. This integration allows for even more comprehensive and accurate representation of patient data. This powerful partnership enhances the quality, granularity, and utility of health information worldwide. Let's consider a real-world scenario. A patient arrives at the hospital with symptoms that suggest pneumonia, such as cough, fever, and difficulty breathing. The doctor carefully examines the patient, listens to their symptoms, and orders diagnostic tests to confirm the diagnosis. In the past, using ICD-10, the medical coder might have simply entered a general code for pneumonia without specifying the underlying cause or the circumstances in which the infection was acquired. However, with ICD-11, the process is much more detailed. The system allows the healthcare provider to select from a range of specific codes, such as pneumonia caused by a particular type of bacteria, or pneumonia that developed while the patient was already in the hospital. This level of specificity helps paint a clearer picture of the patient's condition. This detailed information is incredibly valuable for public health officials and researchers. It enables them to track disease outbreaks more accurately, identify patterns and risk factors in different populations, and develop targeted treatments or prevention strategies based on real data. For hospitals and clinics, ICD-11 also streamlines the billing and reimbursement process. More precise codes mean that healthcare providers can document the care they deliver more accurately, which leads to fairer compensation and fewer disputes with insurance companies. Another important example comes from the field of mental health, where accurate diagnosis and classification are essential for effective care. ICD-11 introduces more nuanced codes for a wide range of mental health conditions, including different types of anxiety disorders, depression, and other psychological issues. This allows clinicians to better capture the complexity of each patient's experience. As a result, mental health professionals can provide more personalized treatment plans, researchers can study mental health trends with greater accuracy, and patients benefit from improved care and understanding. These real-world examples highlight how ICD-11 is revolutionizing healthcare. By offering a more precise and comprehensive language for describing health conditions, it empowers clinicians, researchers, and policymakers to make better decisions and ultimately improve patient outcomes around the world. The adoption of ICD-11 is not just a technical upgrade, it's a paradigm shift in how we collect, analyze, and utilize health data. By moving to this new standard, healthcare systems around the world are embracing a more unified and comprehensive approach to medical information. This change means that diagnoses, treatments, and outcomes can be recorded with greater accuracy and detail than ever before, setting a new benchmark for global health data management. This standardized system paves the way for a future where health information is seamlessly shared and analyzed across borders. No matter where a patient is treated, their medical records can be understood and utilized by professionals worldwide, breaking down barriers to collaboration and care. This global compatibility is essential for tackling health challenges that know no borders, such as pandemics and rare diseases. With more accurate and granular data, researchers can conduct more robust studies, leading to new discoveries and improved treatments. The ability to compare and aggregate data from different countries and populations enhances the quality of medical research, accelerating the development of innovative therapies and evidence-based practices. public health officials can track disease trends with greater precision, enabling more effective prevention and intervention strategies. Real-time data allows for quicker responses to emerging threats, helping to protect communities and save lives. This level of insight is crucial for managing both chronic conditions and sudden outbreaks. Furthermore, ICD-11's electronic format facilitates the use of artificial intelligence and machine learning in healthcare. These advanced tools can process complex datasets far beyond human capability, uncovering trends and connections that might otherwise go unnoticed. These technologies can analyze vast amounts of data to identify patterns, predict outbreaks, and personalize treatment plans. By leveraging AI, healthcare providers can offer more precise diagnoses and tailored therapies, improving patient outcomes and optimizing resources. ICD-11 is shaping a future where data-driven insights drive better healthcare outcomes for individuals and populations worldwide. As we continue to harness the power of standardized health information, we move closer to a world where everyone benefits from smarter, more connected, and more effective healthcare. In an increasingly interconnected world, a universal language for health is more critical than ever. ICD-11 provides this common ground, enabling healthcare professionals, researchers, and policymakers to communicate effectively and collaborate on a global scale. This shared understanding of diseases and health conditions is essential for tackling global health challenges, such as pandemics, chronic diseases, and health disparities. It allows us to share knowledge, pool resources, and work together towards a healthier future for all. Just as a common language fosters understanding and cooperation among people, ICD-11 fosters collaboration and progress in the global health community. As we face the complex health challenges of the 21st century, ICD-11 stands as a testament to the power of collaboration, innovation, and a shared vision for a healthier world.